Hi, it's Dr. David Green, founder and CEO of R3 Medical. Today we're discussing exosome therapy for a very common problem, which is knee pain. Typical disclaimer, individual outcomes will vary. We can't guarantee them. So, knee pain across the world, over one-fourth of individuals over the age of 40 suffer from chronic knee pain. And it may be so bad that people aren't able to simply perform activities of daily living without significant pain. The options for avoiding surgery with knee pain have hardly changed in the last few decades. You can use a cane or a walker or a brace, like an offloader brace, anti-inflammatories, maybe Tylenol, something called nutraceuticals, which if you've heard of glucosamine and chondroitin sulfate, that's what those are. You can get those at any drugstore over the counter. Narcotics, when times get bad, maybe steroid injections. Steroid injections, also called cortisone injections, have been around since the 1960s. They ridiculously are still considered the gold standard by insurance companies. They provide about 2 to 3 weeks usually of pain relief. They can degrade joint cartilage and cause other problems. There's also hyaluronic acid injections, which a lot of people know as rooster comb injections. When you talk about a knee replacement, obviously it's a last resort. It's an elective procedure. It's not a risk-free procedure, and typically you're going to need it redone after 15 years or so. And when you look at the results, years and years ago, we used to think it was about 90% effective, and we now know that that is not true. Several recent studies have shown that almost 40% of people still experience significant pain in that knee after a year, and that pain typically does not go away. So one of the most common requests that our doctors get is, can you please help me with the other knee so I don't have to undergo the surgery that didn't work very well? And when you look at two sides of the cliff, the left side would be the Band-Aid treatments I mentioned before, the right side would be a knee replacement. Now we finally have something that bridges that gap so that a lot of people don't have to go, to the other side. They do so well. And those are exosomes. So it's really a new paradigm, a non-operative therapy that can repair and replace damaged tissue, provide relief, and improve function. And it's low risk. It's an outpatient procedure. It's very effective. And our doctors give the injections right into the painful joint. So how do exosomes work? Well, they really work indirectly through cell-to-cell communication. They help to promote new blood flow. They help to reduce the harmful proteins and substances coming from one's own immune system. They prevent cell death, which is called anti-apoptosis. So here's a picture of how they are generated. Any type of cell in the body can generate an exosome, okay? It could be a stem cell, which is what we care about, or any other cells. But basically inside a cell, a bubble forms, and that's called a vesicle, in this case an endosomal vesicle inside, and that contains the exosomes, which themselves contain what you see here: cellular proteins, messenger and microRNA, cytokines, growth factors, and they then get released, expelled from a cell, and then the exosomes float through the joint space or the blood and hit up target cells. And then they get eaten, ingested. And once they get ingested, you can see here they release all their contents. I call that the information payload, because that payload will then go around in the cell and repair and replace and restore, damaged tissue and make it healthy again. So here's a few things that we know about exosomes. They're not cells. They don't have a nucleus. They're very safe. We've never had a significant adverse event in thousands of cases. As I mentioned, they have a humongous information payload that gets released and will facilitate your body's response to helping repair the joint damage. They're actually byproducts of cells, in this case from umbilical cord. They get processed at an FDA-regulated lab that is CGMP compliant, ISO certified, very high quality assurance. I want to present a few studies that are out there from just the last couple of years. This one talks about the crucial role of exosomes for regulating a lot of things inside a damaged joint, including cell migration, proliferation of those cells, helping to differentiate them into cartilage, ligament, synovial tissue, and then production of an extracellular matrix, which is what is collagen and cartilage for helping cushion the joint and provide pain relief. Here's another review study where they took numerous studies and pulled them together, and they showed that exosomes exert a therapeutic effect in a diseased joint by increasing cell viability and proliferation to help repair the joint, suppressing inflammation, so it helps reduce pain, inducing tissue repair, and offering protection against the progression of arthritis. In conclusion, the outcomes of exosome therapy for knee pain have been absolutely stellar. Close to 90% of patients tell us a year out that they're very, very happy with their results. We've not seen any significant adverse events, and there has not been any in any of the studies that have come out. We see long-lasting results, typically over a year, often 2 to 3 to 4 years. We use a lot. We use 100 billion exosomes per joint, and it's a fantastic way to relieve pain and avoid surgery. Our knee pain program around the country includes a free phone consultation with our licensed, experienced doctor. That way, you can sit in your living room and talk to one of our experienced physicians. We charge about half, sometimes 60% less than any other clinic in the country because of our high volume. And we pass those savings along to you. It's only $24.95 for 100 billion exosomes into a joint. Or if you want both knees done, it's $39.95 for 100 billion each. Doesn't have to be a knee. We can do any other joint as well. R3 Medical has been featured on every major media channel you can think of. Also, we've won a lot of awards, 10 Best, 10 Most Innovative, 50 Smartest. To get the process started, it's very simple. Call us today at 888-798-5665 or visit us online at avoidsurgery.net. We look forward to helping you. To get the process started, simply give us a call at 888-798-5665 or visit us online for more information at avoidsurgery.net. Thanks for watching. We look forward to hearing from you.